Okay, you guys, so first, of course, we're going to undrape, expose the whole leg. Make sure when you're doing a lot of this work for the muscles that we covered in this section that you're undraping in a way that you can see their whole leg. If they're wearing underwear, make sure you can see it. If they're not, then just look for their hip to be exposed. Okay, if you guys want to tuck, of course, you can tuck underneath. And then I usually tuck underneath the small of their back in that little concave area so you get a nice tuck there. Okay, starting out, of course, with your effleurage, long strokes, getting a good layer of cream or oil and assessing, right? So you can even assess the adductors, even though I won't talk about them just yet, but assess how they feel. I feel Holly's are tight. Okay, but we've got first the quads. Okay, so we have all quads attach or insert where? Tibial tuberosity. Okay, so the quads come together, they all sort of come together above the knee and then encompass and stabilize the patella and then attach into that tibial tuberosity below the knee. So with any quad issue, you want to make sure, even though we're not doing a lot of lower leg today, I usually do like some circles or just a little bit of pressure over that tibial tuberosity. A lot of times it feels good. How's it feel? It feels good.
Do you want me to keep your face in the movie? Or?
You don't have to.
Okay. Because I'll get a better shot closer up.
Yeah. So nice long strokes encompassing the whole area. Again, so we've got rectus femoris, which acts at the two joints, flexes the hip and the knee. Okay, so we have the ASIS, which is our prominent hip joint or hip bone, but the rectus femoris doesn't attach there. It attaches at the inferior, AIIS, anterior inferior iliac spine. So when I'm working that attachment site, I start at that ASIS and then just kind of roll down into a little bit of a depression or cave. And then I just do some cross fiber forward and back with my thumb usually. You can probably use your fingers. Okay, you can also probably do a little bit of kneading in there. How's it feel? Good? Okay, and then of course goes down and attaches or inserts at the tibial tuberosity as well. Okay, lateralis, obviously on the lateral surface, and medialis on the medial surface, and the intermedius is below all of them. Okay, so I do a lot, of course, while I'm warming up the tissue, I do a lot of kneading. Okay, kneading, effleurage. I like knuckles on this too. My fingers usually start to pop as my hands get warmed up. Okay. But notice I'm getting everything. I'm going all the way up to her hip. Okay, so those are the quads. Next one, the Sartorius. Okay, that one comes in at that ASIS, anterior superior iliac spine, and then creates that S curve across the top of the thigh and inserts at this proximal medial tibia at that pes anserinus attachment. What is another muscle that attaches there or inserts there? Gracilis. Okay, so the gracilis also inserts there, but that runs that medial border of the thigh, upper thigh, and attaches up at the ischium. Okay, so good. So Sartorius, of course, does a lot of things. Most commonly helps us do that tailor motion with our leg. The last two muscles I want to get to with this section, TFL and IT band. So in the book we talked about how it's like 3 fingers or 4 fingers width. Okay, and it's right behind that ASIS. So whenever I'm trying to figure it out or find it on my clients, I create that. So I find that ASIS, put my 3 fingers there, and that's where it is. Okay, the front of my finger is going to create the medial border of that IT band. And then behind, the lateral side of it is actually going to come from behind. It comes part of the glute maximus. So it does come behind those 3 fingers very much, or that TFL. Okay, so for me, I'm always surprised at how much more anterior or medial the TFL is, because I always think it's a hip flexor or a hip muscle, so I think it's more back here. but it's right here at the front of the hip. So kneading is always really nice to do here, some petrissage. Okay, and you can always do some knuckles in that area. Feeling good, huh? Okay, and then when you get down into that IT band, same thing. Knuckles are one of my favorite techniques to use on the IT band because it feels really good and you can get some nice even pressure as you travel up there. Okay, another great technique, if you go to the opposite side of the table, is like this raking, or however Mike calls it. I think he calls it raking, right? So you're kind of grabbing the back edge of the IT band and traveling down from the hip to the knee to do some good cross fiber across that whole IT band. People that have IT band issues are going to be really feeling this, especially in this more proximal area. They might have a little bundle of knots here. They kind of call that the hornet's nest. Okay. Also good is you kind of swap. Okay, so you have one hand pushing down, the other hand pulling up. Okay, that's a nice crowd pleaser. Okay. Depending on where your client may feel extra tension, you can spend more time. So that IT band does come down and encompasses and protects and stabilizes the lateral knee. So they might be having some knee pain as well. So don't be afraid to work the outside of the knee too. Okay. So last thing I'll demo and then we'll wrap up and I'll let you guys practice is more of kind of like a myofascial stretch for the IT band. The bad thing is I have a lot of cream on my hands, so I won't be able to show it the best way, but if I wipe my hands off a little bit, you'll probably get a good idea. So first one is you're going to start, obviously nice lunge, good body mechanics. You're going to rotate their leg medially, okay? And then I kind of put the heel of my hand or the palm of my hand towards the back side of the IT, okay? And then push direct pressure. Make sure your elbows stay straight here because then you're really pushing with your whole body rather than when you're forward, then you're more pushing with your shoulders and your arms. You get tired a lot quicker. So push with straight arms, okay, and I'm just basically pushing. Because I have some oil on my hands, I'm sliding probably a little bit more than I would like, but essentially I'm allowing her tissue to take me in and stretch nice and slowly. Pressure okay?
Kind of pushing straight in and up a little bit?
Yeah, slightly up. It's another one of those stretches where the longer you're in it and the more their tissue moves, the more intense it's getting as you go. Okay, so keep tabs on your client. Watch for those nonverbal cues, the eye squinting, the jaw clenching. Okay, maybe in their hands they might like start to clench their hands together a little bit. Okay, as you get sometimes over that edge, you'll see the muscle jump just because it's tight. Okay, so I would say 1 or 2 times during a session I would do this because you definitely don't want to overwork the IT. Okay, so that's one of them. Finish with some jostling, loosen those tissues. The other one is more of a long stretch. So I start at the knee, same thing. I'm pushing direct pressure on the heel or mid part of my hand. Okay, and I usually start back a little bit, and then same thing. I'm pushing in a lot and just slightly up towards her hip, and I'm creating length. Nothing going on in this hand. I'm just kind of bracing or holding on. You can put it wherever is comfortable for you. So again, because I have some oil on my hands, I'm moving a little bit quicker, and I feel more of a, you okay? Okay, so see she tensed up a little bit there, so I came back a little bit with my pressure in. Keep breathing, you're doing good. So same thing, the more you go, the higher up you get, the more intense it's going to be. And again, she kind of, whenever I feel that muscle jump or that movement, then I come away, okay, and I'm kind of going back in, just doing some like kneading and long strokes to that area that jumped, because that's the tight part. So we want to loosen that. So I might spend a couple seconds loosening that area. Again, a little bit of jostling here. And then I may start back and do a similar type of stretch around the area that we saw her muscle jump at. So I'm right about here. And this is like the area of that, like I mentioned before, that hornet's nest, where people just tend to carry more tension. And it's also like that axis or angle of strain between their hip and their knee. There's a little bit of an angle there.
Is that hornet's nest of quads, or is that IT band?
It would be in the IT band, the front part. Almost, I'd say most of the time it's at the bottom of the TFL, right where the TFL and the IT band, those tissues kind of come together and attach and connect. So there is going to be, any time where there is a change in tissue, so from a tendon to a muscle or a ligament to a bone, there's an area of weakness there, because the muscle, you know, like I said, they're going from one type of tissue to a different type of tissue, okay? So just to review, I want you guys to warm up the quads. Pay attention to some of those attachment sites. So tibial tuberosity, practice getting into that AIIS. So start at the ASIS, roll down into that little valley, work a little bit across fiber here at that rectus femoris attachment. And just, this is about the best way I learn is naming the muscles in my head as I work over them. Okay, and if that's the best way for you guys to start with learning those muscles and palpating them, then who cares? Be systematic, because once you understand it, you're able to flow better. So work those quads. Same thing, assess that Sartorius, so ASIS, down to the pes anserinus attachment. Okay, and then work that TFL. So practice that. Go to ASIS, do about 3 fingers, do some kneading in there, some knuckles. Okay, you can even get in a little bit with your elbow, depending on, or forearm, depending on how comfortable you are with it. And then practice those 2 myofascial stretches, one from the side and one from the knee. Okay?